Hi, my name's Charlotte Hitchcock, and I can tell you now that DNA was only discovered about 11 years before I was born. So that starts to tell you the journey that I've been on with genomics and genetics in general. I now am the Director of Nursing and Midwifery for the Central and South Genomic Medicine Service. But I wasn't always working in genetics, research, or anything, and that is part of my journey into this. I started as a theatre nurse, which you might say is completely removed. However, I was at a children's hospital where we were routinely told that the condition might be genetically related. We had no means of knowing. When the 100,000 Genomes Project started as a consequence of the Human Genome Project, which finished in 2003, having successfully sequenced the very first human genome, taking 13 years and $3 billion, we actually started seeing what those implications might be for healthcare. We looked at children with rare diseases, cancers, adults and families with rare diseases and cancers, and started to look at the sequencing of genomes for certain conditions in order to establish whether the conditions were hereditary and maybe what genes were involved. I started working as a genomic ambassador and found that I was so involved in wanting to see how this could actually transform lives. From there, I went on to work for NHS England in their genomics unit, making sure that nurses started to understand the importance and the relevance to their own professions. I'm not the standard way into genomics. I don't have research. I didn't work in genetics, but I did work in an area where I realised that patients were affected by genetic conditions. And that for me is what's most important for all of us, is that we understand that genomics affects every practice that we have. There is nothing that isn't affected. Patients attending trauma, they might be affected for their healing conditions. And there may be pharmacogenomic reasons why they cannot be given specific drugs because of how they metabolize it based on their own genetic makeup. There are all sorts of reasons to find out more about genomics. And for me, I want to make sure that that is part and parcel of nursing and midwifery for the future. We're currently working on loads of different programs of work that are aiming to look at different conditions. We've just started on the generation study. This is led by Genomics England in partnership with NHS England. And we're starting to sequence the genome of newborn babies to find out whether or not there are any conditions that they might have, which are metabolic conditions, which may not be picked up normally until much later in life. This is opening up the door to a whole load of further opportunities in developing treatments, finding out routine answers for conditions, and also for many people offering a diagnosis where previously people had just had to say, I have, for example, a dystrophy-like condition, but I don't have a name. So for me, what I realise is that I have a genomic journey. For all of us working within healthcare, we have a genomic journey, and that is to see where we can find out more about genetics, not see it as a scary subject, but something which actually affects our patients and can affect our own families and our own friends. These are important things. It's also really important that we reach all communities. We've got to make sure that we explain and allow people the opportunity to be correctly informed about what genomics and genetics means to them. And as nurses and midwives, we see patients from birth right through to the end of life. And we need to ensure that we are able to offer them the same opportunities throughout their journey.